You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, preventing heart disease, and also, which according to my first guest is the most important thing, and that is preventing heart disease. He's going to give us all some tips. With us, we have the founder of the Manshadi Heart Institute, board-certified cardiologist, Dr. Manshadi. Dr. Manshadi, welcome to the program.
Thank you. Thanks for the invitation.
Now, you do a lot of things, by the way, as a cardiologist. Like, who's the typical patient? Or maybe I should say, what are the different things you do? Like a typical day or week?
So, we do a lot of stuff in our practice, but a typical week, we see everything from prevention to intervention. There are patients there that have already had an event, and I, for example, saw them first time in the hospital, and they had a heart attack. I put a stent in their heart. They felt better. They survived. They've come for follow-up. And then there are patients that have symptoms, variety of symptoms that could relate to heart disease, and they get referred to me by their primary care doctors, or based on their insurance type, they can come and find me and they see me for areas of expertise that I have. My expertise is interventional cardiology, but athletic heart, women and heart disease, I focus on all of these categories to help my patients.
Okay, now you wrote a book. Called The Wisdom of Heart Health. I read the book, anticipating this interview. It's easy to read. Who should read this book? Do you make your patients read this book, by the way?
I do my best because I put a lot of emphasis and time in writing this book. It's not for me, it's for the patients. I think the best patients out there are the ones that are well versed and understand their disease process. They understand their health, they understand their body.
Okay.
And I queried my patients in the past as to if I write a book, what would interest them, and I focused on their questionnaire that I put out, and the answers that they gave me.
So as a cardiologist, so these are kind of like what you've been, what you're asked about for the last 20 years or so?
Exactly. So I focused on the questions that most patients that really want to know and understand. And who should read it? There are different types of patients. As I mentioned in the past, my motto is the best intervention is prevention.
What does that mean to you?
To me, it means to be educated, to know how to live right so that you have a robust and strong heart and healthy heart for the rest of your life.
Okay, so now, one of the things, and we talked a long time in our green room, and I'm paraphrasing you slightly, but you say there are people dying all the time that it could have been prevented, possibly, if they would have just gone to their cardiologist or asked to speak to a cardiologist for consultation. Is that right?
Yes, very good question and observation. Unfortunately, we tend to put off our symptoms. So there are two types of patients. People that really have symptoms and they do not come and see cardiologists, which they should. They should see their primary care doctors, mention their symptoms, and ask to be referred to a cardiologist, a competent cardiologist where things can be done right. I'm totally against doing all kinds of tests. I'm more into doing the right test for the right patient and getting the diagnosis and helping my patients.
Okay, good.
So that's the focus here. And then, of course, as you mentioned, as far as prevention, it is very important that some patients have positive family history, but they have absolutely no symptoms. What does that mean? Their father died at the age of 50 with a heart attack. Their grandmother died of heart attack at the age of 60. Or their uncle recently passed away from heart attack at the age of 60. But he himself or herself...
Feels good.
Yeah, feels good, does exercise, runs, cholesterol has been running normal. They look at the total number, not the morphology, and they don't know exactly where their cholesterol should be. And those patients should be concerned because that's one risk factor that is not modifiable, but we can talk and figure out what other ways we can fight this, where we can delay or possibly even stop or even reverse.
So those people should see a cardiologist then. So it runs in your family. You have no symptoms. You're seeing your primary care physician. Things are fine. Is it covered by Medicare? Is it covered by insurance to say, I want to see Dr. Manshadi, because everybody in my family seems to have this problem?
Yes, of course. If you are concerned enough and you have
could they see you?
Yes, of course.
Okay.
So there are, as you know, different types of insurances.
Like PPO, they could for sure see you.
Right, PPOs, Medicare, all those individuals can come and directly just call and come and see me. Based on their insurance, or if they're HMO, they have to go through their primary care doctor before they are referred.
Okay.
So if there's a major concern there, they should be seen by a cardiologist, and the right testing should be done. That's very important.
Is it a bit of maybe one of your frustrations that there's a lot of people that maybe they have light symptoms or family history like you mentioned, but they just even don't take the advice of their primary care physician to go see a cardiologist?
It is quite frustrating because we are there to take care of their health, and if we feel that they should be seen or tests should be done or to be on top of things before something negative may occur, they should be evaluated and treated appropriately. I have seen, for example, I'll give you an example.
Okay.
I had a very healthy 85-year-old gentleman that would go on treadmill all the time and was my patient, has history of heart bypass surgery even in the past. And I would tell him that even though you're doing exercises all the time, I feel that it's been a few years that we have not done any stress testing on it to see if your heart can withstand this, even if you're not having symptoms. Because as you get older, or if they are female, the symptoms of heart disease may be different, especially in a patient that already has heart disease. So he kept delaying and delaying and delaying and delaying. Finally, he agreed to do this. But unfortunately, 1 week before he was going to have his test, on his treadmill, he passed away suddenly. So it is very important.
Well, what would you have done, though, respectfully? Maybe if you got him, if he would have seen you, you could have put him on the appropriate medication or told him to lay off the treadmill for a while, or what? Like, what could have saved a guy like that?
Well, number one, he should have listened to me and had the test done. The test would have detected something, because there are things that are called silent ischemia, meaning that you may not feel the chest pressure, but on exercise tests, as we are monitoring, we see significant abnormality.
Interesting, okay.
So that's called silent ischemia, and especially in someone that already has heart disease. And based on how severe that is, we could have done the right things. Next step, and next step would have been to do some kind of an imaging study to see how much of the muscle of the heart is at risk for damage. If it's mild or a small area, then we can treat medically aggressively and do the right things, continue to do the right things. But if it's a large area at risk, if something were to happen, then the chance of sudden death is much higher.
What are the stats on people, I guess their first symptom is, sudden cardiac death? Is it like...
So this is important because it is heart disease, dying of heart disease, mortality from heart disease still is #1 cause of death in the United States.
Okay.
As a cardiology organization, we have done quite well with education, technology, doing all the right things. Over past 10 years or so, the risk of dying from heart disease has reduced by 30%.
Okay, good.
So, but still, it is one of the #1 cause of of mortality in the United States. So, 50% of the time, the first sign of a heart attack is sudden death.
So half of the people that have a heart attack die.
Right.
Interesting.
So that's why we should be aware, we should be educated, we should know when to see a doctor, we should know when to do the right testing, and take control of your
And of those
your health.
50%, you think you could have saved a big percentage, half of those people?
For
if
sure.
they went to, is that right?
Yes, of course.
And these people all have, obviously, they have families and kids and things like that. I mean, it's tragic.
This is unfortunate, but that is very true.
Because we all hear the story, the golfer, he's feeling pretty good, he dies. Right. Recently, a famous athlete in the news, Gandolfini, died of a heart attack in Italy or something like that.
That's correct.
And
so on top of your lifestyle, depends, some people are couch potatoes, and all of a sudden they want to see this they watch this show and they want to know, now run and start becoming exercise active, right, eat right. Those individuals I highly recommend to see a cardiologist before they do that. Why?
Okay.
Because you don't know what's going on within their arteries. They've been living unhealthy all their lives, eating potato chips, watching TV on the couch, gaining weight, abdominal obesity. Okay. You have to be clear before you start doing aggressive exercise.
So, for example, I have a friend. He goes, Randy, he's buying a $3,000 bike, right? 55 years old. I've known this guy for years. no exercise, doesn't eat right, just got a divorce. Now he's going to go cycle, 30, 40 miles a day or something like that. So you're saying a guy like that, those are ideal for you. Get checked out first. Is that right?
Yes, that's right. That's exactly right. Now, your friend should be very careful because all these years, the plaque that is developing inside their arteries, it's there. And we don't know how aggressive it has developed.
But he has
time.
no symptoms, he says.
It doesn't matter because he hasn't been active. So,
interesting.
So on many occasions, I deal with some executives, and they routinely run. The first symptom that they have is they get tightness in their chest or throat when they're exercising aggressively. But they're used to running all the time. Before, I was able to run 10 miles without any problems. Now when I run 5 miles, I'm more tired, more short of breath, or I'm getting chest pressure. Why is that? That's a very classic symptoms that they have developed significant blockage in their heart, and they need to be seen
So
right
if you're
away.
an athlete and you are getting shortness of breath where you normally didn't,
Right.
you've got a problem. Is that right?
Especially those individuals over age of 35.
And that's not normal to have every once in a while?
If you've been exercising all the time, doing 10 miles, every couple of days, and you have no problems, all of a sudden now you are not able to do that. If you go off exercise for a month and you go back, yes. But if you're routinely exercising and all of a sudden now you're not able to do as much as you were able to do before, or gradually it's getting worse even though you're doing the same exercise, there's a good chance that there's something going on.
Do some people self-diagnose and say, oh, this is just part of aging, now I'm 50 or 60?
That is very true. I've had some patients that thought this way. And they came in and I looked into their health history, did some testing, and found a problem, eventually led to having an angiogram or heart catheterization. And they had one significant blockage that, especially in a critical area, that needed to be treated. So this one thing that does not escape anyone based on socioeconomic status or any other entity is coronary heart disease. It's basically there are risk factors out there, genetics being the worst, and one of which is diet and exercise.
Okay, so for people just tuning in, we're talking to board-certified cardiologist. He is the founder of the Manshadi Heart Institute. We're talking about the athletic heart at the moment. We're going to talk about women and their specific symptoms. You're a professor at UC Davis as well. And you're a busy guy. You're the president of your local medical association. Is that right? What's your goal with this? Because you live, eat, and breathe this stuff about the heart.
Right.
Is it to save lives? It seems like an obvious one, but
obviously, I think every physician that have gone through medical school, the reason that they went into medical school is to save lives and make their colleagues or friends or fellow human beings feel better. I don't doubt that very much. Everybody. Now, the drive is quite different from one physician to another physician. Now, I've always valued knowledge.
Okay.
I always strive to learn more and more about everything in life, where not only that you can be more healthy, but more wise and a better human being.
Okay, good. And people also need to know, and we talked a lot about the book you wrote. Even this, you're not here to promote the book. You don't take profits from this book. The profits are to fund defibrillators, like in schools. Is that right?
That is 100% correct. One of the reasons that I've written this book is not to only educate my fellow human beings and patients, but also all the proceeds of this book I have been using to purchase defibrillators for local high schools as much as possible. And I've had a lot of high schools asking for help, and I've been, whatever money that I acquire from selling these books, I put together and basically buy defibrillators for those high schools. And as you know, research has shown that time is of essence. Everyone can call 911, but on occasion, they don't even get there for 5 minutes. And if you apply a defibrillator in these young athletes, if they have a syncope or pass out suddenly while they're doing some athletic activity, the survival, if it's applied within 1 minute, is 90%. The survival goes down to almost 5% in 3 or 5 minutes.
Interesting.
So that's why
you want to get these in every high school in America?
as if it's possible, that's my goal. Yes.
Okay, good. Now, also, we should mention you're accessible. I invited you on the program today, but if somebody has Medicare, if somebody has a PPO, they can contact your office directly, and they can deal with you. Is that correct?
That is correct. So basically, I'd like to help every individual, every patient that has question about their heart health as much as possible.
Okay.
But at the same time, it is also a business, and we have to run a business, and every employee needs to make money. I used to see patients even for free when they came to my office if they couldn't afford to see a physician. As much as possible, that's my goal, is to help people. But at the same time, it is very difficult to deal with some insurances. And eventually, I would end up not only not being profitable, but even lose money and unable to really maintain a profitable business if I was to
But
continue
you
the
take
same way.
insurances.
So all insurances that are PPO or Medicare are able to come and see me. HMOs, they have to go through their primary care doctor.
So if they get a referral from their primary care
Right.
doctor, and most primary care doctors will say yes, right? I mean, if a patient says, I really want to see Dr. Manshadi, chances are they're going to say okay, right?
Pretty much 100% of the time, if any patient likes to see any doctor that they like to see, that their primary care doctor would send them to that physician.
Okay, good. Let's talk about women for a second. There's a lot of women, you say, that have heart disease, and they have, I guess, I don't know what you call them, but, events, cardiac events, and they don't even know that they had it. And then you say they're different than men. So what are they, and speaking to the women now, what do they need to know?
Women are quite different, mainly because of the hormonal variances that they have compared to men, but their symptoms for having blockages is quite different than men. The classical symptoms for men is chest pressure with exertion going to the throat or left arm.
Shortness of breath,
But-
tightening of the chest for a man.
Right, but
Okay.
for women, they could say that all of a sudden I was active and I had profuse sweating, or all of a sudden I became significantly fatigued, or all of a sudden I had some shortness of breath but absolutely no chest pain. So the symptoms, the symptoms are quite variable and quite different than men.
How old, by the way?
So
Like in their 60s? Because they would think it's hot flashes, right? If they're sweating?
that's right. So basically,
Interesting.
Women are protected by their hormones, and they're delayed about 10 years longer than men. So basically, if men start developing heart disease, for example, in their late 30s and early 40s, women during menopause, about early 50s.
Okay.
So they're 1 decade behind men. So like you said, that's a good point. All of a sudden, they have diffuse sweating, and they think it's their menopause. But in essence, it could be CAD and
What does that mean?
coronary artery disease,
Oh, okay.
and it could be their angina equivalent. And angina basically means having symptoms secondary to blockages in the heart. So those individuals, women should be very aware.
So they had a minor heart attack?
It could be a heart attack, or it could be what we call ischemia, which means angina, which means there are warning signs that you're
There's
pending,
blockages.
Right, they're pending to have a myocardial infarction or heart attack in the near future. So those are warning signs. So sometimes, unless you do a blood test or look at EKG right at that time that they're having symptoms, you wouldn't know if they had a heart attack.
Okay.
Later on, once you do an ultrasound or if you do some other imaging testing, you would see, or based on EKG, that they had a heart attack before. And they would say, no, I don't remember ever having chest pressure, but did you have sudden profuse sweating or fatigue at in the past few years or months or so? They would say, oh, yes, there was a time where I had profuse sweating and started having nausea and vomiting.
So nausea too?
Exactly. And I just laid down, but next day I kind of felt better. So they probably had a heart attack.
So what does that mean? So if somebody's watching this, they probably had a heart attack. Nausea, sweating, fatigue.
So
And no chest tightness though.
that's right. That's a very much of a possibility, especially in women. So if that happens and you're feeling tired after that or short of breath after that, you need to see a cardiologist right away, because there are tests that we can do to detect exactly what happened and prevent having this kind of symptoms or possible even death in the near future. So that's very important.
Okay, the good news though. I mean, many people go to your office worried, and you say they leave, and I'm paraphrasing again, but with peace of mind. Elaborate on that.
We do get quite a variety of patients out there, and there are patients out there that may have these kind of classical symptoms that are classical for women, diffuse sweating and all that. That could be heart attack. And sometimes they have atypical symptoms that are, but what happens is their anxiety and nervousness brings on more of these symptoms over and over again. And they get more anxious and they have more chest pains. They get more anxious, they have more chest pains. So they're driving themselves crazy. They come in, we do the appropriate testing, we do the risk stratification testing, and we say the likelihood of you having significant heart disease is extremely low. I think your symptoms are atypical. Just watch your diet and exercise, like we say to everybody, and continue on this straight path. And they say, thank you, that's all I wanted to know. And I think by just knowing this, I'm going to feel better. And that's
Is that men and women?
Mainly women, as far as the stress and anxiety part, but there are some men also as far as that. Men, usually the women are the ones that are making them going and getting checked because
Men put things off, right?
Yeah, they do, yes.
So
women do also, but for their heart disease because they're not well aware that they could have heart disease.
Okay.
But 34% of women die from heart disease rather than breast cancer, for example.
So Dr. Manshadi, we really are kind of running short on time. And I know you want to talk about diabetics. So what does every diabetic need to know? Because you said, I think you told me this in my green room, as soon as you're diagnosed with type 2 diabetes, that you need to ask to speak to a cardiologist. Is that right?
That is 100% correct, yes.
Interesting.
Diabetics, at the onset of diagnosis of diabetes, 50% of these diabetics have significant, what does significant mean? That more than 70% blockage in their arteries, whether it's in their carotid arteries, their heart arteries, or leg arteries. So significant number of these individuals already have well-established coronary or vascular
But it's not in the
abnormality.
current protocol that if you've been diagnosed with type 2 diabetes, to go see a cardiologist?
So diabetics are different because they have macrovascular disease. What does that mean? Well, that basically means that their arteries are at the very small arteries are diseased, which can affect target organs, mainly nerves.
Okay.
So when the nerves do not function well, you do not get classical chest pain. So they may all of a sudden feel fatigue or tired or sweating, similar like women do. And they may not attribute this to heart disease. And by the time they come and see cardiologists, they already have such advanced coronary artery disease that we cannot help them as much, but just only medical treatment.
Because there's so many things. Obviously, early detection is the key, as you've mentioned. But it's hard to get people in early, right?
That's right. So most people that feel well, they do not want to come see doctors. Or if they, for example, they have to pay co-pays, they don't want to come and see doctors. But what's the most important thing that God has given us is our health. And you want to maintain good health. If, for example, you end up becoming diabetic, there are ways to reverse diabetes even.
Okay.
So exercise and diet and losing weight can possibly even reverse diabetes. So, which can also halt and reverse coronary artery disease.
So you could reverse heart disease.
Of course, there are ways that we can reverse heart disease.
So if you get people early enough, you could reverse heart disease.
That's 100%, or at least halt and minimally reverse.
Okay, good. And a final message about these sport drinks, because you don't like sport drinks, like let's say these high energy, high caffeine drinks.
Being an expert in athletic heart, I've seen a lot of athletes always want to have the edge. I've seen people that are executives and they want to be awake all the time so they can be more productive. They would take these 5-hour energy drinks. The problem with these 5-hour energy drinks is that the content of caffeine is not known, and it could be up to 300-400 milligrams of caffeine, which with excessive amount of caffeine can trigger electrical abnormality, spasm of the arteries, heart attacks, even arrhythmias, which can lead to sudden death. So if you really need sleep, your body is made to have 7 to 9 hours of sleep. Get your rest. If you If you're not feeling up to par, maybe you have some other secondary medical problem that needs to be checked on. For example, thyroid disease. If your thyroid level is low, you can be sluggish, and you think by drinking these, you're actually adding insult to your body. So all athletes out there, all older individuals, all executives, healthy people that want to have an edge, please stay away from these energy drinks. And if you're really dehydrated, you need some fluid. Water is the best supplement.
I keep saying we're out of time, but we really are this time. I think we'll have about a minute and a half. But the executives, the executive heart health program, what type of executive would you like to see come in? So, and what can you do for them?
Right. So there are, as you know, there are, and I'm sure you have interviewed many executives. They're highly driven. They have highly stressful lives. They don't have time. And it is very important for these individuals to be checked because on many occasions, because of their lifestyle, they have significant heart disease and they may not know it. So there are ways that they can come, they can have the proper testing done, and not only know if they have heart disease, but what is the risk of having heart disease for the next 10 years, and get on the right approach in life where they can become even more productive with the right diet, right exercise, and knowing and understanding their heart health.
Okay, good. And we've talked a lot about some kind of, the scary things that could happen. And I know going to cardiologist has got to be bad news for most people, right?
Doesn't have to be.
But it doesn't have to be.
No.
If somebody wants to make an appointment with you, I guess you take just about every insurance. How do they do it? Just call your center, visit your website.
Right. So my website is quite thorough, and it's has a lot of good educational material and information. It's basically www.drmanshadi.com.
All right. I want to thank you for coming on the show. Very interesting.
Thank you.
And also, they can get your book. They can order your book.
My book is available all the Barnes & Noble stores, online and in the bookstores, and also at Amazon and any other areas.
Okay, you're going to have to sign my book. You didn't sign the book last time you were here. So I want to thank you for coming back on the program.
Thank you. Thanks for the invitation.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.